Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. I'm talking with you from my new home in Seattle tonight, and I am looking out over a very dark sky, and it's only 4 o'clock in the evening here, but we definitely don't have the sunshine of Texas that I had gotten used to before. But anyhow, I'm glad to be with you here, and as many of you know, this is a webinar where you create it with your questions. And I look forward to seeing what you have in store with me tonight. We're going to talk about all things Lyme disease this evening, okay? So for those of you that have not participated in one of these webinars before, there's a couple ways that you can participate. Number one, you could go bold on your first visit here and write a question to me. And where you can write that question to me is in the chat box on the bottom of the screen. And just realize when you write that question, try to be short. This format does not work well for in-depth life story kind of questions, okay? So this is more useful for getting quick answers that it tends to work best for that, okay? Be aware as you write questions too that I probably will not get through all of them tonight. I never do, but take a chance. We might get to you. I generally try to take these in the order that they're written to me to begin with, okay? All right. And then the second thing, the way that you can participate is to hear the questions or read them. In the live version, you'll actually be able to read them on your screen and see how I respond to them. There's a lot of good education that happens out of that as well, too. Okay. All right. And then, as usual, I am creating a recording of tonight's webinar. And my intention is to have it edited and a summary created of it with timestamps so that you can look at it tomorrow morning, somewhere around probably between 9 and 10 Seattle time. I should have that done and get the email out to you with that information as well, too. Okay. I don't think I have any other information. One other piece, if you are in the live version tonight, and I alluded to this earlier, I will post the question on the screen. And so you will be able to see that question if you're in the live version. But because most people that listen to this recording are not in the live version, I will wind up reading the question to you as well. Okay? All right. So, oops, looks like I just lost my video feed there. Hold on here just a minute. All right. So let's go ahead and get started here. Let's see. All right. So this first question is from Melissa. Melissa says, is there hope for MCAS, mast cell activation syndrome, to ever go away, or is it symptom management forever? It seems I have developed MCAS after chronic Bartonella and Lyme and yeast overgrowth. My neck lymphs have been intermittently swollen, throat tightens in response to food that past year, but I never previously had any allergies. Trialing H1, H2, quercetin, LDN has helped tremendously with swelling, energy, POTS, etc. Should I consider food IgE testing despite no previous allergies? Well, I have to take H1, H2 forever. I am now starting yeast Bartonella treatment with itraconazole, nystatin, methylene blue with cryptolepis, knotweed, oregano, cinnamon clove. Will continuing to treat reduce MCAS? And do you ever recommend pulsing breaking from nystatin to prevent resistance? Thank you always. I'm so grateful for your help. So you're welcome, by the way. So those are some good questions and some good issues to consider here as well, too. So the regarding, so everyone, mast cell activation syndrome is a complex illness. And basically, we have these cells called mast cells. Traditionally, we've thought of them as being the allergy cell, that the only thing that would activate them is if you had something you were allergic to and your IgE allergy antibodies attached to it. They would then carry these things you're allergic to, attach themselves to the mast cells, and the mast cells would react by releasing histamines, and you get the whole allergic reaction. Okay, that's what we historically thought that mast cells do. However, we actually have more information now, and what we realize is these mast cells don't just make histamines, they make a whole mess of cytokines and other inflammatory chemicals called leukotrienes, all kinds of stuff. And they actually can get activated and turned on by allergies, mold toxins, stress, anxiety and stress. I should emphasize that a lot. So if you have mast cell activation, one of the key things is try to control your stress. Do the things you need to deal with stress, okay? And then the other things that can cause them to be turned on are chronic infections, okay? And those infections can be tick-borne infections. They can also be too many yeast living in your intestines. So to answer your question, can you ever get over mast cell activation syndrome? Yes. But what you've got to do is eliminate those things that are triggering the mast cells so they learn to be less reactive, and eventually they will become less reactive. And so the long-term approach is get your toxins out if you have mold toxicity, get your yeast and get your tick-borne infections under control by treating them as you can, which is what you're doing here, okay? And then in the short term, you want to do things to deal with the mast cell reactivity. One of those is to block the histamines that get released by these mast cells, and that's by using what you call H1 and H2 blockers. So H1 blockers would be things like Zyrtec and Claritin. H2 blockers would be stomach acid blockers like Tagamet, for instance, is one. Okay, that's a type of histamine. The other thing that is really big that we need to do in this is control your stress. So meditate, deal with counseling, change a job, whatever it is that's giving you stress, you have to deal with it. They're one of the biggest triggers of your mast cells, all right? The other thing we want to do is stabilize your mast cells. We want to make it so that they don't easily release histamines and all those cytokines and leukotrienes that they do, all right? There's actually a few ways you can do that now. One is to work with low-dose naltrexone, which is the LDN that you're talking about here. Low-dose naltrexone binds to a group of receptors on mast cells called toll receptors, and it helps to stabilize them so they're not as reactive. Additionally, I like working with quercetin. Quercetin is a very good mast cell stabilizer. It's a natural substance that comes predominantly from onions and other fruits and vegetables, and it stabilizes mast cells. It also is good at lowering cytokine inflammation as well, too. All right. And then I think one of the newer items that many of us are using is an antihistamine and mast cell stabilizer prescription medicine, which is called ketotifen. And it is a medication that would have to be mixed up by a compounding pharmacy because it's only manufactured for an eye drop, for allergy eye drops, okay? But it's kind of turning into one of the mainstays of treatment. So I usually, in my approach, will start with quercetin, a good H1 blocker like Zyrtec, work on getting infections out, definitely going after yeast early. I find that to be one of the biggest stimulators of mast cell activation. So going after your intestinal yeast overgrowth early. And if those steps are not effective enough, then I may come back and add in a ketotifen. And ketotifen has to be dosed at 1 to 2 milligrams once or twice a day is how you dose that, okay? All right. Now, there's a side effect. It sometimes can make people drowsy. So usually start at the 1 milligram dose first and then go from there, all right? There's also foods you can avoid. There's a whole bunch of other things to try, but those are the essential parts of it. But I do, in answering your question, I do want to let you know that, yeah, you can get over this. Basically, you have to work to stabilize your mast cells so you're not as reactive to it, and block your histamines, doing all the things I just talked about, but get your infections under control, get your mold toxins out of you if they're in you, and that will go a long way towards making it so that you don't have this as a lifelong problem, okay? All right, and then regarding your question about nystatin, I don't find people get resistant to it, so I don't pulse it. Again, nystatin, everyone, is a prescription medication you can use as part of yeast control, okay? All right, now I'm gonna do a quick screen share here. Show you a couple things. All right, so this is my information site, Treat Lyme by Marty Ross MD. And take a look at terms of mast cell activation. I have written an article about that, which is this article here. And I just updated it. I think this morning is when I did it, yes. And what I did add here this morning was information about ketotifen. So I just mentioned. So anyhow, in terms of dealing with it, as this article says, deal with stress, remove the things you're allergic to, get rid of your infections, remove toxins, control cytokines, work with H1 receptor blockers, H2 receptor blockers, be on mast cell stabilizers. And usually I like to start with the quercetin and the luteolin first. And then if those aren't working well enough, then I come down and I like to add in low dose naltrexone. I like to add ketotifen, which I was just telling you about. And I also find benefit using the peptide called KPV. Okay. All right. So there's your outline on what to try. Okay. And then I will just make you aware of an article that I released this morning. And I actually sent out a whole email about it, announcing it. And this is especially important for those of you that are extremely sensitive to things. Okay. So for those of you that are extremely sensitive, meaning you react to about everything and you're wondering how to step into your treatment, you would take a look at, where are we here? In my immune system section, take a look at this article called Sensitivity, How to Manage Extreme Sensitivity in Lyme Disease or Mold Toxicity. A key part of it is dealing with mast cell activation. Okay. All right. Let me go back here. All right. Good luck to you, Melissa. Thank you for the question. Let's see here. Hello, John. Let's see. Hi, Dr. Ross, or hey, Dr. Ross. Hold on here a minute, everyone. I'm just noticing I got a light that's kind of glaring at me a little bit. I'm just trying to rechange my position here, see if we can get it so it's not doing that. Okay. Let's see. Hey, Dr. Ross. Had an appointment with my Lyme specialist, and they stated that my current treatment is good for killing, but since I keep herxing, they want to add low-dose naltrexone. Is this supposed to help my immune response? And is this something you'd agree with? I've been treating with methylene blue for 6 months and ended the herbs over the past 3 months. Biggest players are Bartonella and Lyme. They also want to add GI Revive and GI Detox. Are they good products? All right. So let me see here. So what you're currently using is methylene blue, Japanese knotweed, crypto, skullcap, lumbrokinase. Yeah, I mean, that's a good regimen. You got all your germs covered with that. Okay. So low-dose naltrexone, I mentioned it earlier here tonight because we can use it actually to stabilize mast cells, but it actually has other things that it does as well too. Okay. And so those other things basically, let me describe it. So basically, we have a natural narcotic system in our body made up of a group of chemicals called endorphins. And endorphins are used to manage our pain, but endorphins also regulate the immune system. When you block endorphin receptors using naltrexone, which is a narcotic blocker, what happens is those endorphin receptors start becoming super sensitive to any remaining endorphins that are out there. So they become sensitized, or more sensitive, I should say. And then secondly, what happens is the brain does not like the fact that we've turned off these receptors, and it sends out signals telling the body to make more endorphins, all right? So the effect is when the naltrexone wears away in 4 to 6 hours, these naltrexone or endorphin receptors get flooded with all this extra endorphins, and they're super sensitive to it. So you get improved regulation. Now, one of the things that endorphins do at these endorphin receptors is regulate part of the immune system. And specifically, what they do is they help activate a type of cell called a T regulatory cell. And T regulatory cell is in charge of determining how much inflammation in the body we're going to have from something called Th1, something called Th2, and something called Th17. So Th1 would be all the cells that fight infections. Th2 would be antibodies and your allergy system, for instance, okay? And what T regulatories do is they help create balance between these. So for instance, if you're getting too much inflammation out, cytokine inflammation, for instance, out of your Th1, it's going to help push that down and bring up Th2 to create more balance, all right? So the end result is by getting T regulatories increased, they calm down the Th1, which decreases cytokine inflammation, which can help make it so that you're not herxing as much or having as much cytokine reaction. So it can help your immune system work better in terms of not being as inflammatory. It can also help make your immune system more functional to fight the infections as well too. So yeah, I like using low-dose naltrexone. Other reasons to use it is it can help, again, stabilize your mast cells. It seems to help with people that have sympathetic, parasympathetic, or autonomic nervous system dysfunction, where it helps balance that out as well too. So it's a wonderful medicine. The thing about using naltrexone, I just want to make you aware of, is that you need to give it at least 3 to 6, actually, at least 3 months to see if it's going to have any benefit. Okay. It takes time to see if you're going to have benefit from it. And the way that you start it is you begin at 1.5 milligrams a day. And then you do that daily for 2 weeks. Then you increase it up to 3 milligrams daily for 2 weeks. And then you go up to 4.5 if you can tolerate it. Super sensitive people may feel drugged up on it. And so I might start more at a 0.1 or a 0.5 milligram pill in those situations. Okay. All right. Regarding GI Revive and GI Detox, I think they're good products. Okay. All right. So let me just do a screen share and show you more information about low-dose naltrexone here. All right, so if you want to look at where can you find information on low-dose naltrexone, you would actually look here in my immune system chapter. And again, the immune system chapter you can find by coming over here and clicking immune system. All right, and then somewhere down here. There it is. So this article called Low-Dose Naltrexone, LDN, and Lyme discusses all those things that I was just telling you about, okay? And then in terms of, I just do something here. I think it's in this chapter, but Tregs. So I have another article called Boost Tregs to Balance TH1, TH2, and TH17. And in here, I also talk about using low-dose naltrexone. There also is a peptide product that would do the same thing I mentioned in here. It's called Thymogen Alpha 1, which is a product made by Integrated Peptides, okay? But you can read about it here in this article as well, okay? All right, John, thanks for the question. All right, hold on here a minute, everyone. I want to go just adjust something back here that's driving me nuts. Just a second here. Let's see. Is it coming from right over there? It's this one. There we go. Okay, there. I just moved Dad. The light kept shining off of that frame back there, and I could just, it's reflecting up here, bouncing in weird ways that are disturbing me. So anyhow, I think I just took care of that. Good. Okay. Now, let me move on here. Hello, Sally. Sally wants to know best treatment for Babesia. Well, depends. Depends on what you got. So for Babesia, we recognize, these days, we're recognizing 3 major strains, but we think there may be even 15 to 20 strains, okay? The 3 strains that we recognize, one is called Babesia microti, another one is called Babesia ducani, and then a third strain, which is the more difficult strain to treat, is something called Babesia odecoilei. All right, now, what makes odecoilei harder to treat than Babesia ducani and Babesia microti is that it has the ability to sequester or hide itself by wrapping itself up in your blood clotting protein called fibrin, and it just becomes harder to treat, okay? That's one of the reasons. And in general, it's just harder to treat, okay? Now, how do you know if you have microti or ducani or odecoilei, right? So we can do some testing that gives us clues. All right. My favorite way of testing for Babesia is to use IGeneX, the lab system IGeneX, and they have a testing method which is known as the immunoblot. The immunoblot is a methodology they use to see if you're making antibodies against Babesia. And when they test, they're looking to see if you make antibodies against Babesia microti, Babesia ducani, and the genus or species of Babesia. They, at this point, do not have a way to specifically test for Babesia odecoilei. But the way that we kind of get at the diagnosis is if somebody has tested positive for Babesia genus, but they're negative for ducani and they're negative for microti, that often can suggest they might have a chance of having Babesia odecoilei. Okay, all right. So if it is Babesia odecoilei that you have, the strongest agent that we have to go after it is to build a treatment around a medication called tafenoquine. All right. And so there would be a quinoline. Tafenoquine is known as a quinoline, and it would be a quinoline-based treatment using tafenoquine. All right. I'll show you in a minute the article I wrote about that. There's a couple articles. I have one just on tafenoquine and another one on how do you build a quinoline tafenoquine type treatment. Okay. Now, if you actually have a Babesia microti or a ducani, they tend to be easier to treat. They're going to still take 4 to 5 months. But medication I like using as the main medication would be to use an atovaquone-based treatment using either atovaquone by itself or a pill that is a combination of atovaquone and something called proquinil. All right. And I usually don't use tafenoquine in that situation, mainly because there's a shortage of it. And so I would try to reserve it for the people that need it for their Babesia odecoilei. All right. Okay. So let me go ahead and show you my article on how do you treat Babesia. All right. So you would take a look at my infection plans here. And you would take a look at this called Kills Babesia Brief Guide. And in here, I talk about odecoilei and I talk about fibrin and all that stuff, all right? But down here in this section, in this thing, it says use combination antimalarials to cure Babesia. There is a group of treatments I call tier 1. These are the strongest. And there's either atovaquone-based treatments or there are quinoline-based treatments, okay? And here I tell you what you can do to build a tafenoquine treatment, okay? All right. You want to combine it with some other things, and I lead you through how to do that here. For an atovaquone-based treatment, my preference is actually to use the Malarone pill, and then I like to combine it usually with a Zithromax or a clarithromycin as part of that treatment, okay? All right. The last thing I told you is that there is a whole article I have on tafenoquine, and it's this one here called Tafenoquine, a New Babesia Wonder Drug. So if you want more information about tafenoquine, take a look at this article. It's a video article that I recorded earlier this, I believe it was, February of 2025. Okay, so it's still a very current article as well too, okay? All right. Good luck to you, Sally. Hello, Jennifer. Hello, Dr. Ross. Hello, Dr. Ross. I appreciate the 2 hellos. That's good. Thank you for allowing me the honor of your time and wisdom. You're welcome. I was originally diagnosed with Lyme in 2019 after a visit to urgent care. I did a combination of doxy and amoxicillin for 10 to 14 days. It worked like a pacifier for my symptoms, but before the short antibiotic treatment was completed, my symptoms were returning. I've tried multiple approaches since, including liquid Alamed, lumbrokinase, and Teasel, then another effort to find healing with many years of homeopathic treatment. I was told I was getting better according to her computer scanner as my numbers were going down, but I still didn't feel good. Fatigue being the worst symptom. I was suspicious of Bartonella for many years as I would get random welt-like scratch marks that weren't scratches anywhere on my body. And according to her scanner, I did have Bartonella number but supposedly was homeopathic. We made the decision to stop. Let me see if I can find the rest of your, oh, here we are. We made the decision to stop because of tremendous expense and little progress. First, fast forward a couple of years to the present. I currently have debilitating lethargic type fatigue every single day. I've had this fatigue for years. I also have pain somewhere almost constantly. I have chronically low iron, depression, anxiety, OCD, and I also deal with chronic phlegm. I wasn't able to do anything in the way of treatment for over 2 years because of surprise pregnancy and then breastfeeding. My current care provider just recently ordered a comprehensive tick-borne disease panel, a couple fish panels for my genics. She diagnosed me with Bartonella, Babesia, rickettsiosis, and plasmosis. I'm currently on atovaquone and azithromycin, just started these on Monday, and a bunch of herbs, including cryptolepis and resveratrol from Nutramedix, along with biofibrin. I'm also incorporating Binder Plus. She has scheduled to do, all right, I'm going to take a third part of this, but I'm not going to do a fourth part, okay? All right, let's see here. She has me scheduled to do antibiotics for a total of 14 weeks, switching out and incorporating doxycycline rifampin. The herbs I've been incorporating for several months now, but my fatigue is as bad as ever. I have had gut issues ever since I was a little girl, and I'm wondering how the effects of my ill health and fatigue. I don't sleep well either, waking up many times. All this to say, I'm wondering if you feel like I'm on the right path to find healing, or just what your thoughts are in general. I'd love to thrive and enjoy life, the position God has me in as a wife and mama. I'm currently just trying to survive every single day. Thanks. Okay, so a lot of stuff there, and I'm not going to be able to address everything, but I will make a few points. So anyone that's tried to diagnose you based upon a computer scanner, I have to question. That is not how you diagnose tick-borne infections, right? So you may have made some headway with this provider, but that has no scientific foundation as being an accurate way to do it. I am pleased that you finally found a provider that actually did good quality testing using IGeneX to help identify what infections could be in you. I will tell you, even before you told me that they had done the testing, I was very suspicious based on your clinical symptoms of Bartonella and of Babesia. And here's why I was clinically suspicious. So when you have things like OCD or psychiatric symptoms or severe cognitive issues, think Bartonella, okay? And when you have extreme fatigue, think Babesia. It's more complex than that. There's other symptoms I would want to discuss with you to see if you have, but I'm just cutting to the chase. Those were the two things that stood out in your history. Okay, all right. Now, in terms of, does this sound like a reasonable approach? Yeah, I mean, she's got you on a good Babesia treatment. The cryptolepis will help with that. And in addition, cryptolepis combined with, I believe she had you on azithromycin, if I'm right. Let me go back here. Yeah, she's got you on so the combination of atovaquone, azithromycin is a good Babesia treatment for most kinds of Babesia, all right? The azithromycin, along with cryptolepis, is a good Borrelia Lyme infection treatment. And specifically, the azithromycin is going after intracellular and spirochete Lyme. So Lyme has 3 states that it exists in, appearances, I should say. One is spirochete, corkscrew-looking thing. Second way is that it moves inside of your cells. We call that the L form or intracellular. And a third thing is it has a microscopic cyst. In addition, these 3 appearances either can be growing or hibernating. We call those hibernators persisters, all right? So the azithromycin is good for growing spirochete, growing intracellular. The cryptolepis is good for growing and persister, spirochete, intracellular, and cyst formative germs. Okay, so you've got good coverage there. All right, and then that's for Borrelia, and those same things, azithromycin, cryptolepis, are going to be a Bartonella treatment. This is a good starting place. Okay, one thing I want to caution you, and you'll have to talk with your provider about this, is I disagree with taking pauses in your Bartonella or Babesia treatment by pausing or pulsing for any period of time where you're off of agents that are dealing with those infections, all right? So Bartonella and Babesia both replicate every 24 hours. And so if you are working with, some providers like to try to pulse their antibiotics for these infections. So like have somebody on it for 2 weeks and then stop for 2 weeks, or have them on it for 5 days and then stop for 5 days. And for the most part, that does not work well for Bartonella and Babesia. For Bartonella and Babesia, you should be doing something. Now that may mean after 5 weeks or 6 weeks, they change you to some other agents, but make sure those other agents are still killing Bartonella and still killing Babesia, okay, that they've got you on something for that. You do not want to pause those treatments until they are done, okay? And so on average for Babesia microti, Babesia ducani, you're talking 4 to 5 months of treatment, all right? On average, for most people, about 85% of people, Bartonella, when you've never really treated it adequately before, is about a 6-month treatment, all right? Now, some of you listening in are probably laughing at me thinking, what? No way. Keep in mind, 85% of people, you can get through a Babesia treatment in about 4 to 5 months, and you can get through a Bartonella treatment in about 6 months, 85% of the time, okay? But most of you probably listening on this Bartonella, we're not, or in this webinar, we're not in that 85%. You're in the 15% where it can take a year, 2 years or longer to get these things under control, okay? So anyway, I just wanted to go through that with you, okay? But yeah, does this sound reasonable? Yes, it does. I don't know what this biofibrin is, but if it is something that it breaks down fibrin, if it's an enzyme like lumbrokinase that breaks down fibrin, that's a good idea, because Bartonella and Babesia, two of the things that make them difficult to treat, especially odecoilei Babesia, is it can wrap itself up in fibrin. Bartonella, we know, wraps itself up in your blood clotting protein called fibrin. And when these germs get wrapped up in fibrin, they get stuck with the fibrin on your blood vessel linings, and they become hidden, and the immune system and the antimicrobials can't get to them. So a key component of a Babesia or a key component of a Bartonella regimen should be to use lumbrokinase as an enzyme to break down those fibrin. If your biofibrin does not have lumbrokinase in it, I would discuss that with your provider and make sure what she's doing that would replicate the benefit of a lumbrokinase at breaking those down, okay? The lumbrokinase I like to use is a product by Boluke called Boluke. That's Boluke. It's a 20 milligram pill, and I like in my Bartonella and in my Babesia treatments, once somebody is stable on a regimen about 1 or 2 months after they've started their antimicrobials, I like to add in lumbrokinase as a 16 or 20 milligram pill 1 time a day, and sometimes I'll work it up to twice a day, for instance, okay? All right. So, yeah, it sounds like you're on a good path. I'm glad you had a provider that finally tested you to see what's really there, all right? So good luck to you, Jennifer. Bear with me, everyone. Just trying to clean out some stuff here so I don't read it again. All right. Oh, yeah. So in terms of lumbrokinase products that I recommend, let me just do a quick screen share here. All right. So, oops. Oh, I guess that's not going to go so easily. It should be. I think I have to look at how my search function is going here. Well, that didn't go right. I'm going to have my search engine recrawl the site here. Okay, so one of the products is called, well, actually, we'll do it this way. So when I come over here, we're going to look at one of the companies that makes lumbrokinase is this company called Allergy Research, and the lumbrokinase product I like is here. Okay. The other product I like is called Boluoki. Well, this is interesting. Okay, we had some updates done to my website, and it looks like my search function is not working quite the way I want it to. So I have to go back and fix that. I apologize for that. So the Boluoki is in this area called Candida RNA. And this is the product right here. Okay. All right. All right. Good luck to you. Hello, Cindy. What are your thoughts on the Acudart at home screen testing for Bartonella and Lyme? So I think it's a reasonable place to start, but it only has meaning if the test comes back positive. All right. So the Acudart is an at-home test where you prick your finger and you smear it on a card, and then you send it to the lab. All right. So it's a small sample of blood. The lab that then tests the sample is IGeneX, okay? And IGeneX basically is using its immunoblot method to see if you are making either IgM or IgG antibodies against the various infections. The one way that this test is not as accurate as going to a laboratory to have blood drawn is that the sample size is a lot smaller. And so I think when we look at, if you were to do the IGeneX immunoblot for Lyme or Bartonella or Babesia, we find that when it's a full blood draw, that the sensitivity, the ability for that test to find if you have those infections is about 94 to 95%, okay? That's called the sensitivity, meaning 94 to 95% of the time you have an infection, the full blood draw test that's sent to IGeneX will find it, okay? I believe the study, and I actually was talking to the Acudart people at, I think maybe a meeting or two ago. It's one of the meetings I was at. And I believe their sensitivity, I think, is 80% or 85%. It's about 10 to 15% less for the Acudart test than getting the full blood test through IGeneX, okay? So again, it has meaning if it comes back positive, but because it is not as sensitive as a full-on blood draw IGeneX test, you have to keep that in mind when you're trying to interpret it, okay? All right. But if it comes back positive, it's accurate, okay? All right. Good luck, Cindy. Hello, Myra. Let's see. Hi. Do you think the Hertz Me Too is reliable, and would you be concerned if levels on fresh stuff were significantly above the highest quadrant reading of 15? Thank you. So I do think a Hertz Me, which is one technique that you can use to see if you, in dust samples from your home, if you have elevated levels of various mold spores. I think it's accurate. In terms of how to interpret it, I have to read the report each time to comment, and I'm not sure what a 15 means off the top of my head, okay, unfortunately. But yeah, I do think it's accurate, okay? All right. Hello, Wendy. Hold on here a minute, everyone. Let's see. Should I trust my Vibrant lab results? I have IgG of 26 and IgM of greater than 30 for the Powassan virus. Does this mean the infection is recent? We ran all sorts of tests because of brain fog and cognitive symptoms, also out of breath while in good shape, and hair loss. I have low IgG, maybe CVID. What are typical symptoms for Powassan virus? Okay, so I can only comment on one part of this for you. So Vibrant Labs, so any laboratory like Vibrant or IGeneX or T Labs or Galaxy Labs, that some people use for testing for Bartonella, independent labs, if they are good, should go through what is known as validation studies, where they look to see how good is their test at determining when an infection is present and when an infection is not present. So an idea of how that works, these companies might approach the Centers for Disease Control and say, send us samples that you know have Borrelia in it, and we will supply samples that we know don't have Borrelia, and then we're going to run our tests to see how good are we at determining the ones that don't have it, and how good are we at finding it when it's there, okay? That's a validation study. And independent labs need to do that because they don't have to be certified by the Food and Drug Administration. The labs only need to be certified for their laboratory if they are selling their test kit commercially to other companies to use, okay? And as part of being able to commercially sell their product, they get FDA approval. And as part of FDA approval, they have to do validation studies, okay? But independent labs that are not selling their test kits to some other laboratory to use don't have to do validation studies, but you want to use a lab that does do validation studies because you need to make sure that what they're reporting is accurate. So when it comes to Vibrant on their tick-borne infection, and I'm not sure about Powassan, I'll come to that in a minute, but on the tick-borne infections that they test for, meaning the bacteria, I guess I should say. So Borrelia, Babesia, Bartonella, Anaplasma, all that stuff, right? They have only done adequate validation studies for their Borrelia test. Their Bartonella and Babesia test, for instance, by many of us that work in the field, we think it produces erroneous results, sometimes saying an infection is there when we really don't think it is based on symptoms, and sometimes saying it's not there when the symptoms scream one of those infections, for instance, okay? And so, when it comes to Vibrant, the only infection test result I trust is the Borrelia. I have not talked with them specifically to see if their Powassan virus test has been validated. So on that count, I don't know. Maybe it is, maybe it's not. I know I have been able to look at their studies on the Borrelia to know that it is, okay? In terms of symptoms of Powassan virus, it would be similar to most chronic virus infections: fatigue, headaches, body pains. What it's basically going to do is if it's in you and active, it's going to trigger your immune system to make too many cytokines. And just like Lyme triggers your immune system to make too many cytokines, just like mold toxicity triggers your immune system to make too many cytokines, just like COVID triggers your immune system to make too many cytokines, just like intestinal yeast triggers your immune system to make too many cytokines. So these all can look the same, which is too many cytokines, make it so you can't think, gives you brain fog, makes you hurt all over, can disturb your sleep, can give you marked fatigue, et cetera, et cetera. So Powassan could look very similar to what Lyme disease does, okay? So in general, I want to let you know, I don't trust Vibrant Labs, except for the Borrelia test, okay? All right. Thanks, Wendy. Hello, Melissa. Cindy, we tested 8 people with Acudart. Only 1 came back positive despite all the testing positive for the Lyme test. The only person whose Acudart was positive also tested positive via Western blot. We are very disappointed. All our others were positive via Vibrant, American, and Argenx. Melissa, thank you for letting us know that. Again, what the data, again, that they would provide, I think, looks at a sensitivity of about 80%. But it's the same point. It's just, it has some, it only means something if it's positive, okay? All right. Thank you for sharing that too. Hello, Kate. Let's see. Thank you for caring about those suffering with tick-borne illnesses. Is OCD a symptom of tick-borne illness? Repetitive hand washing, cleanliness, also sound sensitivity, wears headphones at home during day, combined with misophonia. So when we see a lot of neuro-psych symptoms, we think Bartonella, okay? And so it is possible that OCD coupled with sound sensitivity, which would be a neurologic hypersensitive neurologic agitation, and the other symptoms you're saying here could be from Bartonella. All right. It's also possible that this person has those symptoms independent of having tick-borne infections. But when I see that kind of symptom complex of either hearing or visual sensitivities, psych symptoms of any kind, including OCD, also coupled sometimes with numbness, nerve pains, shakings, and tremors. Those would be some other things you might see too. Think Bartonella. Okay? All right. Hello, Kate again. Let's see here. At Thanksgiving, learned a relative has staph resistant in lungs. Doctors said to not get pneumonia because they can't get rid of the staph. 68-year-old male, no known heart disease. Is there any supplement that would help? I don't know. I would need to ask a lot more questions, Kate. So sorry about that. Hello, Sue. Let's see. I was diagnosed with Borrelia Miyamotoi. What are the symptoms and treatment for this strain? What do we know about it now? All right. So Borrelia Miyamotoi is one of the strains that can give you something called tick-borne relapsing fever. In classic tick-borne relapsing fever, you get periods of relapsing fever. You have cycles of maybe every 2 to 3 weeks, you'll get a high temperature. Okay. That's a classic presentation. But we now think that some people get chronic tick-borne relapsing fever, and it can produce similar symptoms to what Lyme disease does, which is it can give you, it triggers many cytokines, which make it so you can't think, make it so you can't sleep, disturb how your hormonal systems work, give you body pains all over, give you fatigue, et cetera, et cetera. So it can look just like chronic Lyme. Now, most of us, it is my impression that when somebody tests positive for a tick-borne relapsing fever, that in general, if you work with a doxycycline, a tetracycline, which would be one of the primary antibiotics that can work against these, usually using it for a month or two should take care of that component of the illness. Okay? All right. Good luck to you. Hello, John. Let's see. Everyone talks of biofilm on a cellular level and not biofilm of the body organs. Why? Biofilm coats the surface of small intestines, colon, and other body organs. Yeast turns into fungus. The biofilm coating of the surface area of these body organs. Have you treated this form of biofilm in your patients? If so, how have you treated to extricate this form of internal biofilm? So, John, I have not thought of biofilm in the way that you're describing it. I'm usually thinking of biofilm in terms of infection biofilm, meaning biofilm created by infections. Regarding the comments you're making here, I'm not sure what to think of it, to be quite honest with you. Okay? All right. But thank you for bringing that point up. Let's see here. All right, everyone. That's all the questions I have. have here tonight, believe it or not. I have no problem wrapping up early and getting on with my evening here, but I'm going to give everyone a few minutes to see if you might have some other questions here. Hello, Lynn. Let's see. Hello. After a vibrant blood test result, I've been diagnosed with Borrelia baberensis, Borrelia spillimii, Swastin virus, cytomegalovirus, Epstein Bar. I have pain in my feet and hands, extreme fatigue, brain fog, headaches, and hair loss. I was also diagnosed with Hashimoto's originally with high antibodies, but told it was still functioning properly. Recently, I got blood work and my thyroid stimulating hormone was at 150. A week later, my TSH was 98. And 1 week after that, it dropped to 10.65 without being on any thyroid medication. What do you think of such a drastic change, and is this related to Lyme? What do you believe is the best way to treat my diagnosis of Lyme, starting out with this information? Also, as a side question, I've read about phage therapy for Lyme. Do you believe phage therapy is effective? Thank you. All right. So I don't know what to make of your TSH. I have not seen that occur. TSH should not change that rapidly. To answer this, if you were one of my patients, I would wind up doing some literature search. I'd have to get into the medical research to see if a situation like this has been described before, with trying to figure out what the explanations people have had for it before too. So unfortunately, I'm not able to help with that. In terms of phages, phages are viruses that will be present in you that will attack germs that live within you. And most bacteria infections we have will have viral phages that that come with them, if you will, or will show up as a means of trying to help control those infections. All right. So there are Borrelia phages, virus phages that live in you, and they're supposed to be trying to attack the bacteria living in you, the Borrelia bacteria in you, to eradicate it. All right. There is a physician, I believe in Tennessee now, that has come up with what he calls phage therapy, where he works with a device to turn on the phages in you to attack your Lyme. And he's published a study about this, and I'm just blanking on his name, but he's published a study on this that supposedly shows benefit. But I would caution you. I don't know how a device turns on these phages to do something they're already designed to do. All right, number one. And number two, he is the only person that did the study. And he was highly biased because he needed that study to show positivity, because he built a whole clinic around his phage activating machines. So I'm extremely skeptical. All right, that's what I would say to that. And then, so I do think, as I said, I believe that the Vibrant Labs testing is accurate for Borrelia. And that's based upon their published studies, okay? And so but I don't know that it's accurate for Swastin, cytomegalo, and Epstein Bar, because I don't know that they've done adequate validation studies. And as you can tell, I don't use Vibrant. So I can't tell you from working with the lab and their results whether they have clinical validity either. I know scientifically they don't, okay? All right, or they haven't scientifically validated their studies, all right? So if you were, a starting point for your treatment would be to take a look at the Ross Lyme support protocol. I'll show it to you here in a minute, and focus on the key areas, including sleep, lowering cytokines, getting yeast knocked down, and look at the various options I provide about how to kill Borrelia, okay? All right, so let me just show that to you here real quick. All right, so take a look at the Ross protocol here. And in here, I tell you the key areas you should address to get well, all right? So look at my section on sleep. Look at my diet recommendations. Look at how to keep your intestines healthy while you're treating. Look at what I recommend about exercise. Look at why I recommend and how to lower cytokine inflammation. Look at being on a good adaptogen like ashwagandha to help your immune system work better. Adjust hormone problems if you have them. Be on a good multivitamin. Do some basic detoxification steps. There's really not much I suggest at the beginning on immune system boosting because all of these other steps boost your immune system. Treat intestinal yeast overgrowth if it's there. And finally, make sure you're doing something to kill your Borrelia infection. And I give you a variety of ways to do that here. Okay. All right. Good luck to you, Lynn. Hello, M. About treating Babesia, I diagnosed with IGeneX for first time this year with IGeneX fish test for the first time after 30 years. I never took Kryptolepis. I did take artemesinin for 2.5 years. That was 15 years ago. Try to see if there's a second. Oh, here we are. There's a second part. Now I will take Kryptolepis. Question about artemesinin. What is the difference between pulsing? Should I take 3 days on and 11 days off, or 3 weeks on and 1 week off? At what point would I take the lumbrokinase? Okay, so earlier tonight I said I don't like to pulse for Babesia, except there's one drug I will pulse or supplemental pulse, and that's artemesinin. But when I'm pulsing it, I'm also wanting people on a second agent, okay? So your Kryptolepis is a really good herbal antimicrobial that works well against Babesia. When I'm using it for Babesia, I like to dose it at 5 milliliters, which is a teaspoonful 3 times a day. I get very aggressive with it, okay? And in addition to that, you could add in artemesinin. The reason that we recommend pulsing artemesinin is after about 4 days or so of being on it, your liver develops an enzyme that deactivates the artemesinin. So even if you take it longer than that, you're basically throwing your money away because it's being deactivated, okay? So what I like to do is use it at high doses for 3 days and then take 11 days off and let the liver reset. I got that idea from the Chinese who use that as how they treat malaria, actually. They found it effective to pulse 3 days on, 11 days off as part of treating malaria. Malaria is a bloodborne parasite that acts a lot like Babesia does, so we tend to use the same agents against it, okay? The way I'd like to work with the artemesinin is I try to work up to 400 or 500 milligrams 3 times a day for 3 days in a row, and then take 11 days off. And where I will usually start with most adults that are not extremely medicine sensitive is I will start at 2 100 milligram pills 3 times a day for 3 days in a row, 11 days off. And I look to see how does somebody handle that. So sometimes what you're going to find is that as part of a Babesia herx, even if you haven't had air hunger, you're going to get air hunger. And you may get extreme fatigue from killing the Babesia germs too. And when you're on this pulse regimen, you can get worsening of your symptoms from a herx up to 5 days from when you started that first pill. So in other words, on day 4 and 5, when you're not even taking any of the artemesinin, you may be getting worse still, okay? That's the killing effect from the high dose that you took the first 3 days, all right? So that generally is how I found useful to use it, okay? All right. Good luck, Em. Hello, Carol. Let's see. I'm trying to locate liposomal curcumin, what you recommend, but I cannot find it at Phymologist. Do you know the different source? Yeah, let me show you what it is. And again, so a good starting place is to look for the product on my site and then click the Buy Now button that brings you over to my partnership with Phimologist, okay? So as I'm trying to see my search function, here it is. So it's this product called curcumin phytosome by Thorne, which is a liposomal curcumin product, okay? All right. And so this is the product you want to use. And then to buy it with my partnership that I have with Phimologist, you would just click here. And oops, I guess you guys can't see that, but it brings you over to the Phimologist store then, okay? All right. All right, go back here. All right, good luck to you, Carol. Have you heard of a newer medication, Nuzyra? Very expensive, $9,000 a month. Gordon Medical is now recommending it. You know, I just had a patient that is moving their care to me from Gordon Medical earlier today, and he was on Nuzyra. So I just learned about Nuzyra. So it is a tetracycline. So it's in the same family of tetracyclines as doxycycline and minocycline. It is has had some modifications done to it that make it less prone to resistance. All right. I will tell you, I have not seen resistance to minocycline and doxycycline, and it is not clear to me why Gordon Medical thinks this is the way to go. All right. It's just not clear to me. But it is the newest wonder drug, supposedly, but it's just a tetracycline. And we already have tetracyclines that are a lot less costly. So that's my impression of it. Okay. All right. I will also let you know that the patient that had come to see me that was on Nuzyra from them didn't seem to find any benefit from it either. Okay. All right. And I will also tell you that there are no studies involving Lyme and Nuzyra to know if it's any better than other tetracyclines, okay? All right. Hello, Diane. Let's see. Can you have two different strains of Babesia at the same time? Same question about Lyme. Thank you. Yeah, you can. You can have multiple infections, multiple strains. So, you know, the tick that bites you can transmit a number of organisms. And so it can transmit the same family, the same type of Borrelia, or it might have been infected with multiple kinds. Same with Babesia too. So it's possible to have more than one strain of each of those types of infections, okay? Hello, Kay. Let's see. Hi, I'm wondering if I've had Babesia much longer than I thought without good treatment. Had air hunger, but then ended up with many other symptoms I didn't think were related. Start to clear up with azithromycin and mepron. What symptoms may really indicate Babesia that may be overlooked? Thank you. So the classic Babesia symptoms, and I'm going to come to your question, but the classic Babesia symptoms, we think of Babesia as giving marked fatigue. We also think of Babesia as producing in some people a lot of night sweats, air hunger, feeling like you can't get enough air from time to time at rest. It also seems to trigger a lot of imbalance in your autonomic nervous system, so you'll get racing, skipping of the heart. You might, as part of that autonomic dysfunction, get lightheaded or dizzy when you stand because your body is not able to maintain blood pressure the way that it's supposed to. People with Babesia can sometimes get frontal headaches. And then finally, a more strange Babesia symptom that when it's present is really interesting to follow because it gives a pretty good indication of whether you're getting better or not. And that is some people with Babesia will have very frequent deja vu experiences, sometimes daily, sometimes a few times a week, okay? So those are some of the more common things. Now, Dr. Lindner, who has been one of the people that came up with the idea that maybe a lot of our Babesia infections are due to Babesia odecoilei, contends that Babesia odecoilei, because of the way that it sequesters itself in blood vessels and clogs them up in a sense, limits blood flow to your nervous system, resulting in neuropathies that we normally would think of as more Borrelia and Bartonella, but sometimes neuropathies, numbness, nerve pain, may be due to Babesia, okay? In addition, cognitive dysfunction, because again, especially if you have odecoilei, may be due to limitations in blood flow due to odecoilei. So those would be some things to look at as well, okay? All right. Good luck to you, Kate. Hello, Mark. Let's see. Will the Buehner protocol eventually eradicate Babesia, Borrelia, Bartonella, and Rocky Mountain? Antibiotic treatment. Antibiotic treatment for a year, but it came back worse than ever. I'm broke, just trying to get better after 10 years operating about 60%. Thank you, kind doctor. Mark, I'm Dallas, and yes, there is Lyme in NTX in Texas. Yeah, there is. There's Lyme. There's quite a bit of Lyme in Texas, actually. You got ticks in Texas. So Buehner was a master herbalist, and Buehner died, I think, a couple of years ago now. And Buehner died before we had a lot of science showing us that Bartonella and Borrelia, especially, those two infections, have what are known as persister states, okay? And so his protocols were not designed to deal with persisters. So let me talk about persisters. I talked about it briefly earlier tonight, but I'll mention it again here. So historically, we have focused most of our attention on the growing state that Bartonella and Borrelia can find itself in. And in the last 5 to 7 years or so, we now have become aware through laboratory studies that these germs have the ability to go into hibernation, non-growing state. And when they hibernate, the standard things we use against them don't work well, okay? All right, now, when we look herbally, so Buehner, although he didn't know about persisters, there were a few things he did use in his protocols that would work on persisters. One is cryptolepis, but he primarily used cryptolepis in his Babesia treatments. But we now know from studies out of Johns Hopkins University that it's useful against growing and persister Lyme and Bartonella. So if you've had Lyme and Bartonella and you haven't incorporated crypto, it maybe you're just not getting at the persisters well enough, okay? Secondly, we do know from studies, though, that, and then in addition, the Japanese knotweed that he recommends as part of Borrelia has some ability to go after Bart and Borrelia persisters. And then cat's claw that he recommends, some of the studies tell us that cat's claw goes after growing and persister Borrelia. Now, Buehner's Japanese or Sitta Akuta and Hutania, there is no science that has been done recently showing they directly kill growing or persister germs. And in fact, when you really read Buehner, he recommends those two herbs based on an impression they should work, but there isn't laboratory evidence that shows they have killing abilities against Bartonella in those situations, okay? So I just want to make you aware of that. Additionally, there's been newer research that shows that cinnamon clove and oregano can be very useful at going after persister Lyme, Bartonella, and actually breaking up biofilms too. So if your resources are limited, you may want to take a look at a protocol I recommend, which will go after all three of the Bs and deal with persister Bartonella and Borrelia while dealing with growing forms. And that is to combine together a cryptolepis. If you have Babesia, at 5 milliliters 3 times a day. If you don't have Babesia, use it at 2.5 milliliters 3 times a day. That goes after Babesia, Bartonella, and Borrelia growing and persister forms, all right? Combine that with Japanese knotweed at 30 drops 2 times a day or 3 times a day. That goes after growing and persister Lyme and Bartonella, and is very weak against Babesia, but some of the laboratory research out of Johns Hopkins says it might help with Babesia too. And then combine that with Liposomal Cinnamon Clove Oregano Essentials. It's a product by doctor-inspired formulations, and the laboratory research done by Johns Hopkins on those oils shows that they are effective at removing biofilm, and in addition, they are effective at killing growing and persister Bartonella, and the clove oil component may have some anti-Babesia properties as well too. All right, so you might want to look there. It's a less expensive way than Buehner, and I find it to be a fairly effective way at going after them too. Okay, all right. Good luck to you, Mark. Mark, I outlined that approach in my Ross protocol that I showed you earlier tonight. Okay, all right. Hello, Sandy. What herbals or natural remedies would you suggest for EBV? Thank you for your response. All right, so there's 2 things I like to do in my herbal approach to chronic Epstein Bar Virus infection. Number 1, I like to try to stimulate the antiviral part of the immune system. And to do that, I like to work with reishi mushrooms, okay? And usually 400 to 500 milligrams 3 times a day. Mushrooms are full of beta-glucans, which can stimulate the immune system. Reishi seems to do a better job in terms of turning on the immune system against viruses. All right. Second thing I like to do as a germ killer is to work with olive leaf extract. And I like to start at 500 milligrams 3 times a day. And then I try to progress as tolerated up to 1,500 milligrams 3 times a day. And I try to do that for 6 months. In general, clinically, I've seen good improvements with that. Okay? All right. Good luck to you, Sandy. Hello, Lynn. Let's see. Waiting for results back for heavy metal test. Is there a level in test results that you believe it is necessary to detox heavy metals chelation? Is this crucial or helpful to help the process of killing the Lyme? So I have to tell you, I used to do a lot of heavy metal testing for heavy metals, and I would do it by doing a challenge with DMSA, which is a agent that will draw out heavy metals from your cells. And then I would treat if I had anything that the lab said was an elevation. I will let you know, I just never saw much benefit from doing it at all. And the only time I would have to be, I'm just going to speak on, not a small elevation, but if you got somebody with a lot of neuropathy and fatigue, the heavy metals can lead to that. And they've got a level that's 2 times the upper end of normal, I might treat in that kind of a situation. But beyond that, I have found treating and addressing heavy metals to be a very disappointing experience when it comes to chelating those. Okay? All right. Hello, Kay. Thanks. I also had back pain, blood pressure, sleep, maybe blood sugar, and such improve on Sith and Mepron. All right. Thanks for letting us know. Mark, let's see here. Mark says, thank you. You're welcome, Mark. Hello, Jennifer. Let's see. I purchased CaprPlus and Metabolic Daily after your last webinar. I took your survey and I strongly believe I have candida overgrowth. Looking for reassurance that I won't experience any negative symptoms from trying out your protocol. All right. So whenever you start killing a germ like yeast, even with herbal antifungals, you can trigger a Herxheimer reaction. All right. So if you are a person that tends to react with killing reactions to things you take, then instead of using CaprPlus starting at 2 pills twice a day, you might start at 1 pill twice a day. Okay. All right. That would be one thing. The Metabolic Daily, I have had lots of people use that, and I have had only one person report an adverse reaction that he read about online and found there are other rare reports of this as well too, which is it really agitated him. And it eventually did go away after he stopped, but he supposedly had read online that there were other rare instances where that happens. Okay. So I would say maybe, but it's rare. Generally, I find both of these to be extremely well tolerated. Okay. All right. Good luck to you, Jennifer. Hi, Barbara. Please talk about Lone Star tick co-infection as I have this. Thank you very much. So the Lone Star tick is a tick that has a white mark on the back of it that looks like a Lone Star. All right. That's why it's called the Lone Star tick. It is not native to Texas. All right. But it is found in the Southeast and is working its way up the coast. And when it bites you, it transmits a sugar that your immune system reacts to in an allergic way. And that sugar is called alpha-gal. The trouble is alpha-gal is also found in mammalian meat. So mammal meat. So cows, pigs, mammals, okay, lamb, all that stuff, all right? Not in fowl and not in fish. So chicken, turkey, fish is okay, but mammalian meat has this alpha-gal in it. And so if you have an allergic reaction to the sugar that the Lone Star tick injects into you, you will then also have allergic reactions to mammalian meat. And it's really difficult because you'll have meat and you'll get sick from it, basically, okay? So the treatment is avoid the mammalian meat. It also involves doing things to stabilize your allergic reactions, your mast cells, for instance, like using a quercetin, using H1 blockers, following the mast cell activation guidelines that I have, okay? And generally, for most people, over a year to 2 years of avoiding alpha-gal meats should help resolve the issue, okay? All right. I think that's what you're talking about, okay? All right. Good luck to you. Hello, Lynn. Let's see. Do you have any concern with taking too many herbals and supplements, putting too much stress on the liver and kidneys? It would depend on which ones, but in general, no. I find that our liver and our kidneys tolerate these things just fine. Okay. All right. Good luck. And then let's see. Jennifer says, thank you so much for your expert advice tonight. You're welcome. All right, everyone. That's it. We've been through all the questions tonight. I'm not sure if we had a lower turnout than usual or not. Let me see here. Yeah, we did. So we had about 140 people register, which is typical, but we only had about 38 show up tonight. I know we're in the middle of holiday season here, and I suspect that's what's happening. So that's why we were able to get through most of these questions this evening. Let's see. I'll take one more, and then I am going to wrap it up here. So this is from Trish. Trish says, any thoughts on bee venom therapy, PS setting an appointment with you in 2 weeks? So Trish, I would love to see you in 2 weeks. Come on in. Anyone that wants my advice directly, feel free to set up an appointment. As you all know, you can either visit with me doing an educational consult where I am not your doctor, but I give you advice. When I say not your doctor, I mean I can't prescribe or diagnose or write test orders, or you can become a full patient which will require that you come to see me in my office, at least for the first visit, okay? So anyhow, I'm open to that. I have space at this point. As you know, I'll restarted practice. So right now it's easy to get in and see me. I doubt that's going to continue too long, but right now it is. So this is the time. And I welcome helping anyone that wants help from me. All right. So anyhow, regarding bee venom therapy, I have had a number of people that have tried it. And what I will tell you is I've had a few that actually got good results from it. The majority of people don't get anything from it. Okay. All right. But bee venom has a chemical in it that can kill tick-borne or can kill Borrelia. And so it may give some benefit with that. It also, I believe, the chemical is useful as an anti-inflammatory against cytokines, so people will feel better from being on it as well too. So I do have an article on bee venom therapy where I kind of make these couple points there. Let's see if we can find it together here. Huh. Well, I'm not. Oh, I may have gotten rid of it. Sorry, I guess I don't have that article anymore. Anyhow, so bee venom, again, bee venom therapy may lower inflammation, and there is a potential that it does have the ability to kill things, okay? But on the whole, for most people, I don't find great benefit from it, okay? All right. All right. All right, everyone, that's it for tonight. Everyone take care. And I am with you again next week. Next week, I actually will be hosting the webinar from Las Vegas because I'm going to be traveling on Thursday. Thursday afternoon, I arrive in Vegas, and then Friday, Saturday, and Sunday, I'm at a medical conference dealing with hormones, actually. So look forward to that. But I will take time out and visit with you all next Thursday from Las Vegas, okay? All right. I look forward to seeing you then. And everyone, keep an eye out for your email tomorrow morning where you'll get information about how to sign up for next week's webinar and also where to see the video recording of this tonight as well too. All right. Good night, everyone.